We have a female cat here. She's about 11 years old. She's still alive and kicking. And this cat has very sensitive in the area of the urinary or kidney. Don't know if it's urinary and or kidney. If she eats, example, whiskas or yams or any dry food on the medium or lower quality, she'll automatically have a urinary infection or inflammation, and we need to go to the vet. So we have to be careful with this cat. Make sure that it's always high quality food for her, and try to give her as much wet as possible, wet food. So we're going to see, first of all, let's go check out the right eye. There's a lot of pigments, a lot of pigments here. We don't necessarily need to do them all one by one. I find that the body is perfect, so the body wouldn't put pigments in the eye if it wasn't significant. I'm just saying that because a lot of iridologists don't look at the pigments. I see that they're relevant, especially in cats here. So the first thing we're going to look at is here. We don't see it well here, but this is a pigment over a crypt. So there's two signs, and this area is the thyroid. So there is something with the thyroid, probably with this cat. Wasn't diagnosed with anything because we didn't check, but I would definitely, if I would suggest a test to do for this cat, would be a blood test to check her thyroid. We're going to move on here. So we see a couple of little dots and pigments. So this is the bladder area. So we could see that there's some weakness. There's something going on in that area. It doesn't necessarily mean that this cat has or had urinary issues, but in her case, I see a lot of pigments, and this cat did have more than once urinary issues. We have here a black dot, and that's the adrenal gland. There's no direct relationship between adrenal and bladder, but an imbalance in the adrenal can affect the bladder indirectly. So we have thyroid and bladder and adrenal gland issues on this side. On the left side, we can see here, unfortunately there's a shade here, but we can see like somebody took a knife and went to take off the first coat, the first layer of the eye. So if we keep digging, it's probably going to turn black, but we can see that there's degeneration of tissue. Now in this area here are the lungs and the chest cavity. So she's not prone to colds or any respiratory viruses, but this cat does cough like she smokes 2 packs of cigarette a day. So don't know if there's some any issues going on there with her chest, but definitely I can see it here, and I find that she coughs a little bit like there's a bit of asthma going on, but don't know, wasn't diagnosed. We're going to move on here to a black. You can see that this is really black. This is the ovary area. Now she doesn't have her ovaries. When there's black in the eye, normally it's a cancer sign of the 3 past generations. So that means father, grandfather, or mother, grandmother. So somebody in the family 3 generations behind had cancer, not necessarily in the ovary. And it doesn't mean that this cat will have cancer. Very important to note that it's just a cancer sign, that it's genetically there, and it does not mean that it will happen to this cat. Now we have here a darker pigment, and this is the area of the bladder. So there you go, you have your bladder and you have uterus around this area. So again, the bladder area shows up. Now we have the pancreas around here. Not diagnosed with any blood issue because we didn't check, but it would be something that I would definitely ask the vet to check for pancreatic issues, and thyroid back again in this area here for this cat. So this cat, the only thing we know is that she has bladder inflammation, irritation, if there's something with the food. And that's it. But I would definitely, if I would have to suggest something, to do maybe an endocrine blood test for thyroid, pancreas, check the kidneys. We can see that there's a problem a little bit with the digestion, because around the pupil, first of all, the pupil is supposed to be nice and straight, so we can see that it's jagged, and we can see that there's a little bit of darkness around, so that means there's trouble with the digestion for sure. And we can see it too on this side here. Even with the shade, we can see that there's something going on with the digestion here.